So this presentation is on Saw Palmetto, and it's by Kendra Cook and Thomas Gilchrist.
Saw palmetto comes from the American dwarf palm tree, and it's the ripe fruit that comes from this tree that is used to make the medicine. And it's most commonly used for decreasing symptoms of BPH or benign prostatic hyperplasia.
So as he said, the most evidence supported is for prostate surgery due to BPH. There's research showing that taking 320 milligrams of saw palmetto daily for 2 months before prostate surgery could reduce the time spent in surgery, the blood loss, and the development of problems during surgery, and total time spent in the hospital. However, there was a small study that found that it didn't lower the risk problems at all during surgery. And then there's many other things out there that saw palmetto could be indicated for, but there's insufficient evidence, and all of these are listed right here on this slide. Things such as chronic bronchitis, asthma, sore throat, those type of things.
Although they are rare, there are some side effects to taking saw palmetto. So you can have some mild dizziness, headache, nausea, vomiting, constipation, or diarrhea. There have been 2 reports of liver damage and 1 report of pancreas damage in people who took saw palmetto. However, there's not enough information to know if it was even caused by taking saw palmetto. There are a couple of contraindications. It's likely unsafe to take with pregnancy and breastfeeding because it acts like a hormone. And in regards to surgery, it could possibly slow blood clotting.
For the interactions of saw palmetto, there's birth control pills, so contraceptives and or estrogen pills taken for any reason. And the reason for this is because saw palmetto acts like a hormone, and it might decrease the effects of estrogen in the body. And then also, if taken with anticoagulants or antiplatelet drugs, it might slow the blood clotting, and it would increase the chances of bruising and bleeding. And then under that, I just have some examples of common antiplatelet or anticoagulant drugs.
So in comparison to other drugs, saw palmetto appears to have efficacy similar to that of medications like finasteride, but it's better tolerated and it's actually less expensive.
These are just a few random facts. So the most widely studied form of saw palmetto is permexin, which uses the solvent hexane. Other formulas have used ethanol, methanol, or liquid carbon dioxide as solvents. And historically, saw palmetto was administered with nettle root and pumpkin seeds, and some modern formulations include these elements. Additionally, saw palmetto is widely used in other countries. 50% of treatments in Italy use it, and 90% of treatments in Germany.
So looking at our studies, the first one, saw palmetto for benign prostatic hyperplasia. It just gave us a little intro. Saw palmetto is used by over 2 million men in the U.S. for treatment of BPH, and it's commonly recommended as an alternative to drugs that are approved by the FDA. So in this trial, it was a double-blind trial, and they had 225 men over the age of 49 who had moderate to severe symptoms of BPH, and they received a 1-year treatment of saw palmetto, specifically 160 milligrams a day, or a placebo. And the results and the conclusion of the study, there were no significant differences between the treatment group or the placebo group. And another study was called Randomized Double-Blind Placebo-Controlled Trial of Saw Palmetto in Men with Lower Urinary Tract Symptoms. So this study was done to assess the effects of saw palmetto on urinary symptoms, sexual function, and urinary flow rate in men with lower urinary tract symptoms. So it was a double-blind, randomized placebo-controlled trial, and patients had to be 45 years or older, and they had to have an International Prostate Symptom Score of 8 or greater. They took 85 men, and they were randomized to receive saw palmetto or a placebo treatment for 6 months, and then patients were evaluated using that International Prostate Symptom Score, as well as a sexual function questionnaire and a measurement of urinary flow rate. So for the results, the group that received saw palmetto actually did have a statistically significant improvement in urinary symptoms. However, there was no apparent effect on urinary flow rates or sexual function. One important thing to note is that the mechanism by which saw palmetto works is unknown, so therefore remains kind of a controversial treatment.
So recommendations to the family member overall is to try with the FDA approved drugs first, and then because there's not a lot of evidence to support the benefits of saw palmetto overall. However, if the side effects of the FDA approved drugs are like too harsh, then using saw palmetto may be a viable option because it appears to have a similar efficacy to medications like fusineride, as we said earlier. However, it's important to make sure that you are not taking any estrogen or antiplatelet, anticoagulant drugs, as we stated earlier. These are our references, and thank you for listening to our presentation.